So what's the experience for people who have a stroke today? It varies a lot. It varies depending on the hospital discharging them, as well as the community they live in, the resources available there, and their insurance. But what we know is that most people discharged after stroke are not getting the resources that they need for their recovery. Fewer than 40% of people discharged after stroke access outpatient therapy. So there is not enough rehab being delivered. Very often, hospitals struggle to follow up with stroke survivors. And so we're not getting data, for example, on how they're doing 90 days after discharge. Fewer than half of patients report that data back to their hospital. For most patients, what we hear from them is that they go home after a stroke and they don't receive any further support. They should be getting home health. They should be getting rehab. They should be getting follow-up with primary care. But it's so overwhelming, they may get one follow-up phone call from the hospital and nothing else. Understanding the challenges of stroke after a person leaves the hospital starts with talking to those people themselves. So one of the things, the very first thing we did when we started Can Do Health was begin working with stroke survivors and their families to ask them that question. We knew from papers and evidence that a year after stroke, a third of stroke survivors rate their quality of life as poor or worse than death. We knew there were problems, but you have to dig into the whys and the specifics. The better you understand a problem, the better you can solve it. And nobody understands that better than stroke survivors. So when we talked to survivors, they told us a number of things. It starts with a need for learning. They didn't understand what had happened to them, and they didn't understand what was going to happen in the future. So they really wanted better information and better education. And then the other biggest ask was community. There's an incredible amount of isolation after stroke. And one of the most important things in stroke recovery is reconnecting with yourself, regaining your agency, regaining your own identity, but then also reconnecting with others in a situation where your own body and even mind might have changed from before the stroke. And so those were the needs we wanted to address first. Was improving education and support and sort of navigating that post-stroke experience, but also reconnecting people with themselves and their communities.